I don't think it's a surprise to many people that we're in a significant mental health crisis. There are all kinds of theories about why we're here, how we got here. Regardless of how we got here, the reality is that people are suffering. We talk about this mental health crisis in Michigan, and one of the reasons we're talking about it is because we don't have the resources to care for people in need. And we're talking about a particular kind of resource that we provide, a program here where we're training people to do the therapeutic work, which is to say to sit with people in spaces where they can deal with their anxiety, their depression, their marriage issues, and so forth in a way that feels safe.
Yeah, so one of the things we're really committed to here is training counselors who have the best clinical training. So they're getting the kind of curriculum that you're going to get at any quality accredited institution in the country. And you're also going to get training that's distinctly Christian and distinctly formative. So we think a big part of training good counselors is training or forming people. That the person matters, that who they are matters, that how they know themselves and know God matters.
The kind of formative training that we offer is what's unique. We call our program relationally oriented, trauma-informed, and rooted in the Christian soul care tradition.
I think that through relationship, we learn more about ourselves, and I think that to be a good counselor, you have to do your own work. And that's best done in community.
So my husband and I are missionaries, and when there's a particular country that we were sent to, the country had gone through a massive genocide. So there was trauma there that we hoped to be able to just connect with people at that level, but we were not able to. The content in the classroom is very rich, and the questions that I'm asking is, how can I be a bridge between what I'm learning right here, right now, and even my country?
Especially coming from somebody in a pastoral role, that I feel inadequate in a lot of times where I'm sitting with people and I don't quite know if this is good advice. And I'm relying on my instincts as opposed to necessarily a deep level of training. And so there's the difference between a pastor and a counselor in that realm, that they are trained to do this work of helping others.
Donor support is so important for a program like this because we're literally building it from scratch. There are extraordinary resources that are needed for this kind of program in terms of spaces and technological resources and things like that. We're also going for the highest level of accreditation. So we need specialists on our team who know what they're doing when it comes to creating the kind of curriculum that allows us to get that accreditation. All of that takes time and money. But I think we're also doing this to multiply goodness in this area, in the sense that we're training therapists to go out to be engaged in practices to meet the needs of West Michigan. And so as you're contributing to a program like this, you're contributing long-term to good Christian mental health care in West Michigan. I think you can get involved, number one, by praying for this program. We're getting into the depths of people's lives and stories in ways that can be really, really challenging. And we need you to pray for us doing the work, and for students who sit with clients at that intersection as they're getting into the deep stories of people's lives. And through your resources as well.
The generosity of our donors has made it so that we can think big and take maybe a little bit slower road, but one that's going to give us a really solid foundation to build on as we build this program out, and to bring the people and the resources that are going to allow us to equip students to become mental health professionals who will serve this community for years to come.